are in listen-only mode.
Good afternoon, Diabetes Sisters. As many of you know, people living with diabetes are at an increased risk of eye disease and one of its complications, blindness. So it's incredibly important for us to learn what we can and how we can prevent those complications of diabetes, including self-management and scheduling appointments with an ophthalmologist. One of the things we've actually come across in holding conferences and support groups throughout the U.S. over the last 7 years is that many women with diabetes are not as knowledgeable about the prevention of eye disease as we thought. In fact, many women are, I'm surprised at how many women are even unaware of how important an annual eye exam is. So today we will be hearing from Dr. Rajeev, Ramchandran, and Mary Bregantini. And before I forget, I want to make sure that you check our Facebook page at the conclusion of this webinar, and you'll see the name of this month's winner of our book giveaway, which is A Woman's Guide to Diabetes, A Path to Wellness, which was written by myself and Natalie Strand. So to get us started, I'll tell you a little bit about our speakers. Dr. Ramchandran is an assistant professor in ophthalmology at the University of Rochester School of Medicine and Dentistry's Flaum Eye Institute. Dr. Ramchandran co-founded the University of Rochester Telehealth Consortium, which remotely connects providers and patients to improve knowledge and access to high-quality care at affordable cost. His own program, TelEyeCare, Diabetic Retinopathy Screening Initiative, provides diagnostic testing and referrals for retinal and other eye diseases affecting diabetes patients during regular primary care visits. Currently, he is working to improve his region's eye care as co-director of the Flaum Eye Institute's Population Eye Health Initiative for Western New York. Our other speaker, who will be second, is Mary Bregantini, and she works as the Senior Director of Program Outreach at Prevent Blindness, where she manages the diverse aspects of vision screening initiatives and program outreach in accordance with the organizational policies and procedures. She aids in the planning, development, implementation, and evaluation of the organization's mission-related vision screening and education programs and services. She has also worked to support the Diabetic Eye Disease Educator Program at Prevent Blindness, and she received her bachelor's degree from the University of Wisconsin-Oshkosh and her master's in urban planning from the University of Wisconsin-Milwaukee. We are really happy to have both of these educators with us today, and we will be taking questions throughout the webinar. You'll see to the right side, you'll see a little plus sign, and you'll see questions. Feel free to type in any questions you have there, and we will try to get to as many of those questions as possible at the end of the presentation. And with that, I will turn it over to Dr. Ramchandran to get started.
Thank you so much. It's a pleasure to be here with the Diabetic Sisters. I am going to talk about what you should know if you have diabetes in regards to eye health. So let's get started. I have no financial interest, just to disclose. So today's goals is to discuss diabetic retinopathy primarily, which is a disease that affects the retina, and it's found in people who have diabetes. So let's talk a little bit about diabetes. We'll talk about diabetic eye disease and retinopathy particularly. We'll have a brief overview of the pathology and the imaging that we do in the eye, and we talk about the classification and overview of the progression of diabetes in the eye, especially diabetic retinopathy, and finally have a brief overview of treatment, risk, and prevention. This is a tall agenda for a short time, so let's move on. Diabetes is a worldwide problem. Many people are affected, and the developing world especially is more and more going to be affected over time. In the United States, it is a significant problem, with many states, especially in the south part of this country, having rates over 10% of the population. The eye is like a camera, and diabetes can affect all aspects of the eye. But the area that we really want to focus on is the retina, the back of the eye, because here it can cause permanent blindness. Now, what is diabetes? I'm sure many of you know if you have diabetes, but just to review, diabetes occurs when you have too much sugar in your blood. The sugar comes from the processing of the food, especially the carbohydrates, and in diabetes, you can't convert it to energy. So it's a metabolic problem that leads to high sugar or hyperglycemia in the blood vessels and body tissue. Normally, you have insulin that allows for sugar to get into the cells and allows the cells to use the sugar for energy. However, in diabetes, glucose will enter your blood and enter the tissues, but there's no insulin or there's resistance to insulin, so that the sugar can't get into the cells and allow the cells to use it for energy. This causes high sugar in the blood, which can be toxic to the blood vessels and cause damage. And we'll review this. That's why it's important to check your blood sugars and to know what level you have of your blood sugars on a very regular basis. Diabetes worsens when you have unhealthy habits. For example, if you eat too much sugar and salt, if you do not exercise. Why? Because blood sugar increases, blood pressure increases, and cholesterol increases. This is sort of the ABCs of diabetes, the hemoglobin A1C measuring the blood sugar, the blood pressure being measured, and the C, the cholesterol. So what happens if you do not control your ABCs? Well, you get organ damage. Uncontrolled ABCs, or glycemia, or blood sugar, blood pressure, and cholesterol cause poor circulation by damaging blood vessels. And important organs will not receive the nutrients and oxygen they need, including the eye, as well as the heart, kidneys, extremities, and even the brain. So how will you know if there's damage to your blood vessels? Well, the eye is the only region in the body, and the retina in particular, where you can see blood vessels, the damage to the blood vessels from diabetes. So it's a very unique structure and important in the diagnosis and management of diabetes. So I said, the retina is the only place in the body where the blood vessels are easily examined. It can be examined by your primary care doctor through a direct ophthalmoscope, as seen in the first picture down into your left. In the middle, an ophthalmologist or optometrist can use special lenses and a slit lamp to visualize the retina. And there are many screening programs there on the right that actually can take a picture of the back of your eye and help diagnose retinopathy. So increased ABCs causes blood vessels in the retina to become weak. They leak fat and protein, cause bleeding and swelling, and this condition is called diabetic retinopathy. It's a very significant condition, and we'll talk about it some more now. Diabetes has other related eye issues, including retinopathy, which is painless. It includes cataracts or clouding of lenses, which can occur faster in those with diabetes, and also glaucoma, which has to do with optic nerve damage due to the presence of higher intraocular pressure than the nerve can withstand. Now, I won't be focusing on these two aspects, but your eye doctor can examine you for all these conditions, and therefore it's really important for everybody with diabetes to have an eye exam at least yearly. So the focus will be on diabetic retinopathy, which is the leading cause of blindness in the United States for the working age population, or ages 20 to 74 years. Normally, the retina looks very healthy there, as you can see on the left. However, with advanced diabetes, you get fibrosis and new tissue development that can pull on the retina and cause detachments. And this retinal detachment can lead to blindness. So prevention is really the key effort in this. In the United States, the prevalence of diabetic retinopathy is increasing. It's about 5% of the population currently, and you can see the darker shaded states here where diabetic retinopathy is more common. Again, I can't reiterate it enough. It is the leading cause of blindness in the U.S. for the working age population, which has great economic consequences. The cases of diabetic retinopathy have doubled in the last decade, which is a great concern. Males and females are equally affected, although the females have a longer lifespan, and therefore in later ages, more females may have this problem with diabetes. The Hispanic population is also at greater risk for a given age, as can be seen here. Now, how does this work? How does sugars affect the back of the eye? Well, high sugar basically destabilizes the small blood vessels, the capillaries, and this destabilization leads to leakage and bleeding, and something called macular edema, or leakage in the center of the retina, which is the region called the macula. Well, this leakage doesn't allow blood to carry the oxygen to the tissues in the retina, which is a very active tissue because you're always processing light that you see. And this inability to deliver oxygen leads to hypoxia, or low oxygen content. This in turn releases vascular endothelial growth factor. And this VEGF factor is very important because this leads to abnormal vessel growth and causes vessels to leak and bleed. And these abnormal vessels that do grow can cause traction or pulling on the retina that leads to vision loss. So diabetic retinopathy causes blindness. One way it does that is through the macular edema, or swelling in the retina, in the center area of the retina called the macula, due to leakage of central blood vessels, as can be seen in this picture here. The other way is proliferative retinopathy, which also can involve macular edema, but it also involves the development of small blood vessels that can grow and cause fibrosis and ultimately can lead to a retinal detachment and blindness. So let's consider macular edema first. It's the swelling of the retina due to leaking blood vessels. And these areas of leakage can consist of proteins, cholesterol, and fluid that causes the retina to swell and causes the photoreceptors that are part of the retina to be disrupted and not process light as well. If this involves the fovea, or the sharpest area of vision, you can lose vision. So diabetic retinopathy with macular edema is responsible for most of the vision loss in this disease. 33% of folks have a 3-year risk of, the risk of 3-year vision loss is 33% without treatment. Now the proliferative diabetic retinopathy, or the growth of new abnormal blood vessels called neovascularization, also includes bleeding and can include swelling, but it involves the abnormal growth of these small blood vessels that can pull and cause traction on the retina that lead to blindness. Permanent blindness can occur in almost half of folks after 4 years with no treatment. So laser treatment has been what has been prescribed traditionally for eyes would have macular edema, that's vision threatening, and also proliferative diabetic retinopathy, that's vision threatening. So laser treatment involves small laser beams that are projected into the back of the eye to help the eye absorb the fluid and help to stop the leakage in macular edema. In proliferative diabetic retinopathy, which we often abbreviate PDR, panretinal laser is needed. So we're actually cauterizing areas of retina that are not receiving oxygen to preserve the central retina in the macula, which is what is preserved here in this photo. And this helps to reduce the risk of vision loss by 50%. However, there could be side effects such as black spots, decreased color, and night vision. So there are new treatments. These are injected into the eye, and these are medical treatments that are done in the office. One of these treatments involves injection of anti-VEGF, or antibodies against the VEGF molecule, the vascular endothelial growth factor. Or sometimes you can inject steroids too to help dry up the leakage and help stop the blood vessels from leaking. But this has to be done periodically because this medicine doesn't last for a long time. Therefore, there now the creation of sustained release steroid devices, as you can see here on your right, that may prolong the effect of some of these medicines, such as the steroids that are implanted in this, and allow for longer-term treatment of the macular edema in these cases. And 50% have improvement in macular edema and proliferative retinopathy, but multiple treatments are often necessary. And for the proliferative retinopathy, usually it's the anti-VEGF agents that have been found to be more effective at treating that rather than the steroids. Side effects are present, such as the risk of infection, which injections the eye, bleeding, retinal detachment, and cataract. There's also surgical interventions. When the retinopathy is very severe, we might have to do a vitrectomy or removal of the vitreous jelly, which can be seen here in this schematic on the left. And after we clear the blood out, sometimes there's traction on the retina, and the right-hand schematic describes how we peel off these membranes and we can remove scar tissue from the retina, allowing the detachment to be treated and prevent permanent vision loss in these cases. But prevention is the key, and we really hope to prevent this disease from advancing to this state. With vitrectomy, you decrease the risk of vision loss again by over 50%. So the stages of diabetic retinopathy are important. They come in mild, which requires a dilated exam, making the pupils big and examining the back of the eye every 9 to 12 months. Moderate, which is the more advanced disease, which you should be examined more frequently at 6 to 9 months. Severe, proliferative, with new blood vessel formation, and macular edema, which can occur in any stage. And the last 3 stages are vision threatening, and they can lead to permanent blindness over a few years. And if you have this level of disease, you really need to see an eye doctor, an ophthalmologist, every few months. So normally, this is how the eye, the retina, looks in the back of the eye. Mild retinopathy involves small retinal bleeding and small dilated capillaries. Moderate retinopathy includes further bleeding and areas of reduced blood flow in the nerve tissue, which are called cotton wool spots. And then the vision-threatening diabetic retinopathy involves the severe retinopathy with severe retinal bleeding, which a 4-year risk of vision loss in this case is almost 13%. Without treatment, and proliferative retinopathy involves new abnormal blood vessels, which involve the pulling on the retina and causing detachment. And 4-year vision loss in this 4-year risk of vision loss is 44%. And finally, the macular edema that we talked about. And as I said, the 3-year risk of vision loss is anywhere between 25 and 33%. So the risk for vision loss in diabetics have to do with longer duration of diabetes, needing insulin. If you're insulin dependent, you do have a higher risk for retinopathy. Higher hemoglobin A1C, especially the hemoglobin A1C levels that are above 8.0, increase your risk for retinopathy and worsening retinopathy. Higher blood pressure, smoking, pregnancy, if you're previously diabetic, and higher low-density lipoprotein cholesterol, the LDL number. That's also found to be somewhat important in increasing the risk for retinopathy. So the risk of retinopathy increases with poor glycemic or sugar control and increasing duration of disease. As this graph shows, the longer you have diabetes, the more at risk you have, no matter what level of hemoglobin A1C you have. But if you have higher hemoglobin A1C, such as 11 rather than 7, you're at a higher risk for rate of retinopathy progression. So after 15 years, about 80% or more have some level of retinopathy. Now the risk of worsening retinopathy, as I said, increases with higher hemoglobin A1C. So a 4-year risk compared to if you had a hemoglobin A1C of 7 versus if you have a hemoglobin A1C of 8 is 3 times as much. So it's really important to meet your hemoglobin A1C goals with your diabetic doctor or primary care provider. Now, glycemic control is a must not only for the eyes, but you can also have retinopathy or nephropathy, neuropathy, or microalbuminuria, which has to do with kidney damage. And these all increase with increasing levels of hemoglobin A1C. A 1-point reduction in hemoglobin A1C could reduce your complications by 35%, though. So controlling your sugars is very important. And hemoglobin A1C, as you may know, measures your 3-month level of sugar control. So it's a very good measure of how well you're doing over time with your diabetes. This is just the range of your various hemoglobin A1Cs, and it relates it to what the mean glucose level is. And I put this here to show you that hemoglobin C above 8 is usually a blood glucose level above 200. So if you're running above 200 often, that's a sign that you're at increased risk for retinopathy and other microvascular or small vessel disease in the body. So when should you get a dilated eye exam? Well, if you have type 1 diabetes, you should at least get an eye exam within 3 to 5 years of diagnosis and at least yearly, but more often if you have different stages of retinopathy. If you're type 2, you should have it at the time of diagnosis and at least yearly, but again, more frequently if you have some type of retinopathy and more often if you have more severe retinopathy. Now, women of childbearing age is important because before conception, if you have diabetes, you definitely should have an exam because you want to know what level of retinopathy you have, where you are when you start with, and also early in the first trimester because pregnancy actually increases the level of diabetes. And this is not for folks who have gestational diabetes, but folks who have full-blown diabetes before the pregnancy, often type 1. So you're increased risk for retinopathy progression because of these 3 things here. Is basically poor control before pregnancy, if you're not well controlled, if you have history of smoking, and if you have vascular damage from high blood pressure or retinopathy from diabetes already. So an eye exam schedule for those who are pregnant and who've had diabetes before the pregnancy is every trimester if they don't have any diabetic retinopathy or mild diabetic retinopathy, every month if they have moderate diabetic retinopathy, and if you have vision-threatening diabetic retinopathy, such as the severe or actually the proliferative form, laser therapy may be needed to help calm the retinopathy down and control the retinopathy before it causes permanent vision loss. So what can you do if you have diabetes and you want to keep eye health? Well, basically take care of your diabetes. Follow a healthy diet. Be active, at least 30 minutes on most days. Get good exercise. Take your medicines as directed. Check your blood glucose. Know your levels. Know your ABCs. Check your feet as well because the same small blood vessels in your feet and extremities are also found in the eye, that caliber of vessels. And so the damage that you're happening in your feet can also manifest in the eye as well. You should brush and floss your teeth every day because good dental hygiene is also attributed to low inflammation and will be beneficial to your retinopathy and other microvascular pathologies, and control your blood pressure and cholesterol as part of ABCs. Finally, smoking is really a big problem, and not smoking will really lower your risk for developing diabetic retinopathy and other complications from diabetes. And as an eye doctor, I recommend that all diabetic folks see an eye doctor at least once a year and more often if they have any levels of diabetic retinopathy. Thank you for your time and participation, and I'm free to answer any questions that you may have.
Hi, thank you. This is Mary Bregantini with Prevent Blindness America, and I'm going to tell you a little bit about our organization and some of the resources that we have available to you. Prevent Blindness was founded in 1908. It is the nation's leading volunteer eye health and safety organization dedicated to fighting blindness and saving sight. We're focused on promoting vision care from birth through all stages of life. Prevent Blindness touches the lives of millions of people each year. We're all about educating people about their vision and the potential risks for vision problems, and we equip them with strategies for maintaining healthy vision and keeping their eyes safe. Prevent Blindness offers several education programs on eye health and safety for adults and children on a number of topics geared toward both educators and the general public. We also educate through public service announcements, newsletters, media campaigns, special events, the web and social media. Prevent Blindness has been doing advocacy work since we led legislative efforts to eliminate ophthalmia neonatorum, which was a leading cause of infant blindness way back in 1917. We work with government officials at the state, local, and national levels, building grassroots advocacy movements and institutional partnerships that will improve our nation's public health policies. I want to tell you a little bit about some of our resources, and really what we have to offer is information that supports everything that you just heard from the doctor just a moment ago. Our website is preventblindness.org, and we have resources specific to diabetes in your eyes. So if you go to preventblindness.org/diabetes, it takes you directly to the page. This is a screenshot of the website portion that's dedicated entirely to diabetes in your eyes. We provide evidence-based information explaining how diabetes affects vision and goes into detail about diabetic retinopathy and other related vision problems that are also associated with having diabetes. We also have videos available. One video in particular is called Live Right, Save Sight. Actually, it's a series of short videos for the general public, but it's geared specifically toward people with diabetes. The first video gives a basic overview of the effects of diabetes on the eye and stresses positive actions that people with or people at high risk for diabetes can take to preserve their sight, such as the things that Doctor just mentioned to you a couple moments ago. And then there are 3 other short videos that go more in-depth about diabetic retinopathy, cataracts, and glaucoma. These videos and associated free fact sheets are available at this website, which is http://learningcenter.preventblindness.org. And everything we have there is available in both English and Spanish. So this is a screenshot of what you will see when you go to the Learning Center to access Live Right, Save Sight. You'll see that there are a number of downloadable PDFs with educational information as well as all the videos. And the videos really have 2 key messages that are relayed. First is the most important thing that a person with diabetes can do is to have a dilated eye exam at least once a year. Some people may need to be seen by the eye doctor more often. And the other messaging is all about a healthy lifestyle, including exercising, eating right, and maintaining a healthy weight, quitting smoking, and reducing alcohol consumption. The Prevent Blindness website and the Learning Center also offer free downloadable fact sheets, and many of them are in both English and Spanish. And finally, one other thing I wanted to share with you. Women are disproportionately at a higher rate of vision problems than men. And yet, a national survey that we conducted last year revealed that only 9% of American women realize that women are at a greater risk of suffering permanent vision loss than men. So to address this, just the lack of knowledge, Prevent Blindness created a website devoted entirely to women's vision issues, which is called CJC Women's Healthy Vision Now. The site provides free education and resources on everything from eye disease to cosmetic safety to vision changes during pregnancy. Valuable information and new data on a range of topics related to women's vision health at every stage of life can be found at cjnc.org. In addition, the site also features a section written by leading experts on topics from everything from the importance of eye exams to the effects of smoking and vision. So thank you for your time and attention today. For additional information on Prevent Blindness resources, please check out our website at preventblindness.org or the CJNC website, or call us at 800-331-2020. And at this point, I would like to hand it over for questions directed for the doctor.
Well, thank you very much, Mary and Rajeev. We have had a few questions that have come in. So Rajeev, I'm going to, you're actually unmuted now, so I think this is something that you may be able to answer. So the first question is, I have diabetes and my ophthalmologist says that I have dry eyes. A friend told me that if I didn't use the eye drops, the condition could lead to other issues. Can you tell me what it could lead to?
Sure. People with diabetes are more prone to dry eyes, and utilizing drops or wetting drops to lubricate the eye is helpful. If the eyes are dry, then your vision may be deteriorated too, because the light doesn't pass through the eye as well, through the cornea, because the surface of the cornea isn't nice and moist. And this lack of moistness and dryness can lead to problems of the cornea or the front of the eye. You're maybe at more risk for infection or loss of tissue on the front of the eye, and that can also lead to vision problems over time. So it's very important to have a nice, clear tear film and a good amount of tears so that the surface of the eye is smooth and allows for good light penetration into the eye to the back of the retina in order to have good vision.
Okay, great. Another question that has come in is, if I get a regular eye exam with an optometrist, is that enough to make sure I'm being screened for diabetic retinopathy, or are there other things I should be being screened for?
Mm-hmm. So a comprehensive eye exam from an optometrist or an ophthalmologist is what is needed. And what do I mean by comprehensive? Well, you should have your eye pressure checked to screen for glaucoma. You should have your eyes dilated or pupils dilated, so drops put in to make your pupils bigger, an examination of the back of the eye, and a full examination. You know, we have a lot of programs that screen with retinal photos, but if you're seeing an optometrist or an ophthalmologist, they should take more than just do a photo. They should actually look inside with a lens, special lens, and do a full examination, because the photos don't see the peripheral retina, the edges of the retina. And that's very important in diabetes, because diabetes can affect all aspects of the back of the eye.
Okay. And our next question is, once you have diabetic retinopathy, is there any way to reverse it? And secondary to that, is there anything to do to slow it down?
Yes, definitely. So if you control your blood sugar, blood pressure, and cholesterol, especially the low density lipoprotein, the LDL cholesterol, and help to lower that, you have a greater chance of actually making the retinopathy better and lessening the risk for it to advance or get worse. So definitely a lot of my patients who have had better control have actually had better outcomes with the retinopathy and often don't need treatment for advanced levels of retinopathy if they do better with their diabetic management.
So I guess the other part of that question is, can you reverse it at all, or once you have it, it's always there?
Yeah. So, I mean, there may be some level of retinopathy. It really depends. Folks who have had great control over time, they have a very minimal to often no retinopathy. But as I said, after 15 years of having diabetes, you do have some form of retinopathy, and it can be mild, and it's not really significant for your vision. So if you have a mild form and not significant for your vision, just monitoring is probably all that you need to do. You really want to avoid the severe forms. And there is a point where you get a very severe form that even controlling your blood sugars and blood pressure and cholesterol may not be enough, and you need further treatments. And some of these treatments can help reverse some of the effects of the retinopathy, such as those injections I talked about, especially with the antibodies of the anti-VEGF agents. They actually help to reverse some of the retinopathy and can make you even see better in some cases.
Okay. All right. Well, that's all that we have time for today. I thank both of our presenters for sharing all the knowledge that they shared with us. I definitely learned some things that I did not know. And be sure to check our Facebook page shortly for the winner of this month's prize, which is the book. So thank you, everyone, and have a great month.